Hello, everyone, and welcome to Open Source Friday India live stream. I'm Karan, and I'm the Director for International Developer Relations here at GitHub. And we're very excited to showcase a whole lot that's happening in the open source ecosystem in India, featuring a whole lot of different contributors, maintainers, and leaders from the open source ecosystem, and bringing you some really nice journeys and also stories, and also how you can grow your own open source projects and contribute as well. So today we have a very interesting story and also a guest to welcome on the Open Source Friday live stream. So this is all about empowering healthcare and also developers to contribute through open source for the betterment of society. That's really, really interesting because, of course, many of us have seen open source contributions and also projects when it comes to how you can really do a whole lot with developer tools or various different projects, etc. But especially with something like healthcare, and also when open source and AI comes together, it's going to be very, very exciting, right? So a little bit more about that in a while. But where's everyone joining in from? How about wherever you're joining in from, you just drop a comment and say hello to all of those people who are coming together with you in this live stream, because it's a celebration of open source. And we see, folks coming in from Latin America as well. That's nice. Hello and welcome. And, say hello to all of the other folks as well. And use also this opportunity to exchange any ideas and also share about what you're doing as well. All right. Now, before we get started bringing on our guest, on a maintainer, let's take a look at, what really are they doing. And interestingly, we have a video to showcase all of the work and impact that they're doing. But trust me, it's not going to be just a video in this live stream. We'll be bringing on the guest for a little bit more deeper intro as well. But let's kind of just get started with the video. And hello to those joining in from Kenya, Ghana, Belgium, Latin America as well, Lucknow, India, and various other places as well. All right. Florida, USA. That's great. Okay, so let's get started, with just a video about how this is, helping healthcare, and then let's bring on the guest. All right. Meanwhile, hello to again folks joining in from Sicily, Balochistan, Estonia as well. Really great to have you folks here. All right.
In India, if you leave the urban region, a lot of these areas are extremely remote, over broken roads and very hilly areas. It's very difficult for anybody to get quality healthcare. OHC stands for Open Healthcare Network. We're a team of enthusiastic developers and contributors committed to building open technology, especially in the healthcare domain. When we started out, Open Healthcare Network was a small effort catering to one district within a state. And today we are covering 23% of the districts in the country.
The ratio of number of doctors and nurses in India is not comparable to the actual number of people who's required. The more time we are able to save, that's the time they can spend with the patients.
We solve for the dearth of specialists by providing tele-ICU service along with a digitized mechanism to refer the patient, if needed, to the urban centers. Today, they are able to access services that was never available to them before. OHC built Care, which is our open source flagship product. It provides a very easy to use, easy to deploy capacity and patient management module. Then on top of that, we have layered more advanced functionalities like telemedicine, tele-ICU. So that allows for improving access across geographies.
This is the only solution that is out there right now to cater to these remote places. That brings healthcare to their doorstep.
We identify hospitals and connect them to the closest care center. Once the patient is admitted, their digital patient records will be maintained by the hospital in the care software. We also have camera integration, which means there are high-resolution cameras in the ICUs that are linked to the software. We've also worked on medical device integration. And we also have a module that allows doctors and nurses to communicate and collaborate. The doctors or the specialists get a complete picture of how the patient is doing. And if the doctors feel that they need to be moved to the hub, then they have a referral system through the software that tracks the journey of the patient. Early on, we were very fortunate to have active participation from healthcare professionals. They're the ones telling us what to build, how to build, and that is built into the foundation of care.
Now you see that code being translated into touching a patient's life, touching a family's life.
Technology assisting physicians, not replacing, lessen the overburdened physicians in a vast country like India. We work together and we excel together.
The engineer showed me how I can contribute on GitHub. I am writing the special issue of I need this button there so that I can have better accessibility of shifting a patient. I see another engineer taking it up. Within 1 week, I see a link to the finished product. That is when I really saw the magic.
We have more than 400 people contribute from around the world, and they actually understand the value of open source. The developers were very interested. They were like, okay, there is a request from a doctor. We have to go solve it for him. Then they go pick up the issue. They actually go and build it.
We have seen the quality of code improve immensely with Copilot. So it's almost like everybody's gotten their own personal assistant.
I just have to say what I want in a few comments, and it's able to write out the entire thing for me. It's like another human helping me out. Having everything in open source from day one actually improved the trust.
When OHC came in, suddenly I realized that the small decision I make, the small issue that I file, now it's impacting millions. Every time I think about it, I get goosebumps like my hair stands up.
ইয়াতে আইসিইউ না থাকিলে তো আমার নিচিনা মানুহৰ কি কৰিব লাগিব
I'm not doing the miracles, but I'm just giving some tips of life-sustaining techniques that's driving me and our team more and more. This healthcare transformation created a very significant positive impact to every citizen of India.
Wow. Wasn't that, really inspiring to see what's possible when developers and open source comes together to solve for, so much that's happening across the ecosystem, right? So that's great. And meanwhile, hello to everyone joining in from across the world oh, wow, I'm seeing so many comments from Estonia, Ghana, Uganda, Pakistan, Brazil, Pune, Poland, India, and Sydney, Australia. So that's great. Thank you, everyone, for joining in. All right, without much delay, let me bring on Bodhish Thomas, who you have seen here in the video just a while ago, to share more about Open Healthcare Network as well.
Hello, everyone.
Hi, Bodhish.
Hi, Karan.
Really, really great to have you here on the stream.
How's your day?
Good. And you have a nice background over there. Hello to Mona as well, right over there in the background. Great, Bodhish. So all of you, Bodhish is the chief architect at Open Healthcare Network, one of the co-founders who started this project as well. And also he is a GitHub star. So to learn more about the STARS program, you can go on to stars.github.com. All right, to get started, Bodhish, a very quick question. How did this all start? What was that spark or the inspiration that led you and the rest of the team to start thinking about even building something like this?
Oh, it started off, if you think about Open Healthcare Network, it's not just like it started off in day one. While it started in 2020, that's when the group of people actually came in together to start working together. So the idea was that there was a very bad flood in Kerala, and we needed people to help out in finding people around the world and get them help distributed in Kerala. So for that, we had to create a tooling, and after that, we had to build something called as after flood to like help people to migrate and go back to their homes which were already flooded. So this experience was like it created a group of people come together to like solve for social goods, and that's how we were able to like conceptualize something called as Corona Safe when the pandemic happened in 2020. So it's like 5 years now. I mean, like really a long journey building open source tooling for the community and helping a lot of people with it.
That's nice. That's great to hear that, this was something which started off as a few developers coming together to solve for the after flood project, and then kind of continue, etc. What was the inspiration or motivation behind actually doing it open source? Why not why not build it and solve for the problem? What was the motivation behind saying that, okay, let's build this in open source and help grow?
So the day it started, like we were very clear from the day one. We were very clear that okay, we wanted to do it in open source, and we were very clear that we want to do it with an MIT license. So whatever we build, it should be useful and helpful for a lot of other people in the community. And also, we wanted the people to come together, help and contribute. It's not just a few engineers solving for like a really complex problem. We want to enable the community and empower them to come contribute to something that can make real impact. So also the experience during the flood, after flood, and then there was Kerala rescue. All of it also like helped us understand. So the value of open source is really immense. Whenever you are stuck, you have people from around the world who can then come in and help you with solving real issues. So we were like super clear. We wanted to do it in open source, and we wanted that to be like a good that people can use and distribute, and literally something free. That anyone can use, take it and deploy, rebrand, and do whatever they want to do with it.
That's great. That's great. So while looking at the video, Bodhish, of course, we understood the grassroots level impact that Open Healthcare Network is having and the CARE software is having. So can you give us a bit more idea on what's the actual usage like today? Where all is it being used, and how is it being used?
So when we started off, it was like a pandemic management tooling that is used in our district in Kerala, where we were helping out connect all public and private hospitals. So any touch point you have with the healthcare, the system was able to like capture the entire data set and plug it into dashboards. I mean, it was like a really interesting pandemic project. After that, it evolved into so we built an EMR, electronic health record underneath the system that came out to be quite useful. Fundamentally, like when we architected the system, it is multi-tenant. So almost all systems in EHR are single tenant. So for states and larger facility organizations to deploy, with CARE, you just need one instance. That powered a lot of new use cases. One of our most common and most widely used use cases called embedded ICU. So it is actually critical care management across 200 hospitals in 8 states. So around the country. So, I mean, if you look at Karnataka, in a lot of districts in Northeast, Assam, Manipur, Meghalaya, all of them, all the government hospitals, these are district hospitals, taluka hospitals, where they have an ICU, is using CARE for managing their critical care. So, I mean, you would have seen in the video, it's not just like just medicine. You can stream the video, you can connect any device that is HL7 FHR compliant into the system and stream that data also to a nearest medical college where a expert doctor can like help the remote doctor deliver care. It's more like a video call plus that can really stream in the patient's record and all the clinically relevant data.
Wow.
So,
What you're mentioning seems, something like almost like an entire patient care and like a health platform itself. And you say all of this is open source and is being built together by the team and community.
Yeah, it's majorly the community that I would like stress more on. Fundamentally, it's a community and like a very smaller team that is driving the entire show. So when we started off, it was just a bit of EMR, clinical health records. From there, we started building out the entire stack from primary healthcare to critical care. So any patient from a PHC level to a critical care facility, like a patient in a critical care, can now be treated with care. And the most recent deployment that happened is in Kerala. That is to support 1 million families for palliative care. So till 2024, we were only dealing with patients in hospital beds. In Kerala, now we're dealing with distributed patients across the state. And these are technically beds that are in patient homes that are being monitored and care being given by the nearby PHCs, CHCs, and the palliative care teams. So it's going to be one of the biggest deployment in the sense like there will be 1,800 facilities covering across the Kerala, and around a million patients will be given care regularly. So that means 1 million patients will be visited once in every month at their home and whenever they need, and all of their records will be entered in care. And the advantage is that everything that gets captured at the home, if they go to like a hospital, like a district hospital or like a medical college for advanced care, the entire record will also be accessible in those other facilities. So whatever is happening at home will be captured, all care given, psychosocial support given, everything get logged, will be visible to the doctors. And the most interesting newer use case that we figured out now is that the critical care facilities and the general hospitals can now build care plan that can now be executed at home by nurses in palliative care.
Wow. So you mentioned and emphasized that so much of this is being done by the community and helping build that. So how big is the open source or the contributor community of Open Healthcare Network?
So we're growing at a pace of like around 60% in the last 8 months. So when the video from GitHub came out, it was around 400 people. Now we are talking close to 940 people from around the world who have been helping us build this out actively. There's been a lot of people coming in inbound. So in our issues now, if you file an issue, there'll be like at least 2 people responding in next 5 minutes, asking to be assigned for them to work on top of these issues. And it's like a really powerful journey now. Like we feel that we are like fully community powered, and people are like really interested in coming and helping out. So we were able to like showcase the value that we are generating to the community, so that they also understand the importance of like how like their code can create impact on the field. So these are like issues that comes from the field. If you help fix it, this gets deployed in the next release cycle, and that is impacting millions of people across India who are using the system.
Wow, 940. That's a really, really good community for helping build all of these solutions in open source. So, and I'm sure, Bodhish, when I'm asking this question, it's also on behalf of so many other developers and also maintainers and participants in the open source ecosystem. How are you really managing, this community? On one side, there is, of course, like an excitement that you mentioned, that when there's a new issue that is created, either in the video or, like right now, that people are so very excited that, okay, here's a problem that I want to solve. Outside of the enthusiasm, how are you really helping manage this community and grow this community? Is there any, secret sauce that you would like to share with everyone?
So, one thing that we really figured out, so from the day one when we started, it was mostly students who actually wanted to work with us. I mean, they had the most amount of time to contribute and volunteer. So we made it like very beginner friendly. So the repository, for you to set it up, you just need to like hit one command, make up. It will automatically resolve every dependency that needs to be installed on the system and get you up and running remotely. And so the entry barrier for doing like a good first issue is like very low. All you have to do is figure out the code and then make a PR. So it's like basically we made it super easy for people to come and help contribute. Secondly, we created a ton of documentation on how you can contribute. So one of it's really funny that like the most number of questions that we get is like how to resolve merge conflicts. So so we had to like build FAQs on, okay, how do you resolve merge conflicts between 2 branches, and how do you fetch from a remote branch? How do you fork? and a lot of content on that. And also for developers who are aspiring developers who want to learn Django or like React and contribute more on, we have also built modules for them to go upskill and come back and contribute. So there is like a full onboarding pipeline that we built. So anyone who wants to come join us, there is a Slack channel that is fully open and sponsored by the Slack CEO. So we are on a pro plan, and so everyone who comes in, they get a invite telling, okay, this is the introduction that you need to do. They also get all the documentations related to where do you get started, from which all repositories you want to see, and move ahead into contributing. So this has really helped us. And secondly, be like as polite and as friendly and as helpful as possible to everyone. So we are like a fully inclusive community. We are super happy for everyone to contribute, come together, bond together, and build solutions that makes a lot of impact. So we have people contributing from around the world. It's not just India. There are people from Nigeria, other parts of the world, which are so distinct that we have never even seen, where people come and contribute with us. Like from US, there are, I mean, it's not just developers, student developers. There is head of New York Stock Exchange, the people like in Hotstar, like in other companies, like a lot of them come and help us. There are also companies like OpenAI collaborate with us to build advanced features on top of care that can also be used by many people. So building the community was a long journey. Like GitHub also gave us a lot of momentum into making this like a reality. This we did the basic. You guys also empowered us to do more. Even the video, it also drives us people from around the world. There has been like a lot of people who comes to Slack and say, "Oh, we saw the video. It was like really inspiring, and we wanted to contribute." So, yeah, it's for me. It's like a 5 year journey on doing it right every single time to build it to this point. And I think we are at the best of all the times right now. We're seeing like immense growth, and like in 2-3 years back, we've kind of figured out that community is the model to go forward, and we wanted to have a lot of stats coming out. So we had to build an entire tooling to like monitor and power the system. We also have an internal leaderboard that people can use. I can show it at a later stage, but fundamentally, there is nothing secret. We have put it all open source as like a as a playbook for other projects to also come inspire and learn.
That's awesome. So, Bodhish, let's take a look at that leaderboard. And while you're just getting ready to share that, so summarizing what Bodhish mentioned, a few key things to really think about as to how you grow the community is one, making it really, really easy for someone to come and contribute and onboarding. So Bodhish mentioned about how they have like very, very simple and easy scripts to just get started, have all of your development environments set up so that if you know where in the code you want to go and then make the change, you can very easily bootstrap and get started and kind of get going. That was the first thing Bodhish mentioned. And second, he also mentioned creating documentation. It's not just about building a really great and a useful project, but also ensuring that there is good documentation for someone who wants to come and get started, irrespective of the experience level, be it a student or a professional as well. So having some real good documentation would help. And also Bodhish emphasized about how it's important. The third point is being very welcoming and supportive. The people who are coming into your project or any open source project are there because they would like to help you solve the problem, or they have that problem and would like to solve for themselves and also give it back as well, right? So being welcoming and open to collaboration will go a really long way. Great. So Bodhish, you mentioned about that leaderboard. So if you can bring that up, let's share it, and you can walk through that to our audience and viewers as to how that works. So I'm going to bring up your screen right now. Oh wow!
So, yeah. So we've closed 949. We hope that we will hit 1,000 very soon. So this is an internal tooling that we have built. It's also another open source project in OHC. You'll be able to figure out. I mean, it's called as Leaderboard. you can fork it and run it on your own organization. So one thing it does beautifully is that collate all the data from across all repositories that you have on your organization and create a full summary. So this week, in the last 7 days, there was 36 issues opened, 34 closed, 46 PRs open, and 35 merged. It brings you like a high-level numbers on what is the activity happening across repositories. And you can also individually go track each and every developer who have worked with you and see what they have done in your projects across the last many months and years. So you can also clearly see what they are actively working on right now and quickly jump into those PRs and issues, and also see all their stats and all the messages. So you can like have filters to like see what are the PRs open, PRs that they have collaborated on. These are all powered by the GitHub's APIs, and we have used it to build it out fully. We also gamified the system a bit, telling there are these badges that you can gain. So if you have creative, we believe that you'll have a lot of creative thinking if you're able to like find a lot of bugs and issues and suggestions. Similarly, you're a problem solver if you can do a lot of pull requests. So we've gamified it a bit for people to like come and explore it. And there are also, you'll be able to see and track like when someone has started contributing with us and how's their journey going ahead with us. And what is their average turnaround time? We don't really use it, but it's stats that you can pull out from the data that is really available because every action is fully tracked on the system. So in this week, we have currently 50 people contributing into care, and that is from across the world and also our internal team. So this is our leaderboard. We also have like a few fancy features like you can pull in issues from GitHub that has specific tags. This can be like across repositories. We'll be able to fetch it and show it as like, okay, live project that you want people to see. There's a feed powered by the GraphQL API. You can like actively see what is happening across care at any point in time. We also have unified the releases from across our repositories. So you'll be able to see the last release, number of people contributed, and the change log, along with all the other releases that happened on the time. So we believe that all of our projects are like interlinked, and all of it coming together makes a lot of sense. And discussions is also another feature. Like anything that gets opened in discussions will also show up here. So everything is public, and there is one place people can like go check and jump into as and when required. It's also fancy in the sense like you have a lot of filters, and if you want many more filters, you can add. In 2025 till March, we have opened 842 issues. We have closed 810. We have merged 1028 pull requests. We've opened 1028 pull requests and merged 703. So this is kind of the stats that we are able to pull off, and the most number of updates was done by Dawn, and the most number of end of the day updates in the system. Nihal is our QA who created the most number of test cases and issues this year. So it's really interesting to see stats across more people, and you clearly know who to assign an issue and how are they contributing with you. And this is also a public profile that they can showcase to other collaborators and potential people who want to like hire them for roles.
Wow. And Bodhish, you're saying this tooling itself is also open source. If I understand that right, can any project or anyone actually fork this tooling to customize all of this leaderboard for their own project?
Exactly. So they can like really take it up and deploy it. So the code does. I mean, the repository is called as leaderboard. It's just like a builder. So all you need to do is fork it, and there is instructions to install it. You will be able to also cache the data for like last many years. So there are scripts that you can run that will automatically call the GitHub APIs to bring in the data from the day the project started. And you can also have periodic sync. So in our case, we do like a 4-hourly refresh of the dashboard. You can configure it in any way you want, but these are all powered by GitHub Actions also. So you can run it in an action. All you need is a repo and one personal access token that is connected to the repository with read access. It'll be able to like fully build it out. It's actually used by many other projects now.
Oh wow, that's great. And for those of you who are watching and tuning in, so this is available on github.com/OHC network, which is the organization which hosts all of the repositories of Open Healthcare Network, and Leaderboard is the project which you can actually start using this with. So Bodhish, before we jump on, we have a question here in the comments. Based on what you are aware of, Bodhish, there's a question on whether does Europe health industry also show an interest about this open source solution. So have you seen any interest or any queries or questions about using something like Open Healthcare Network outside of India as well?
So there have been a lot of inbound requests. Even a week back, I had a discussion with WHO team for the Southeast Asia. So they are also fundamentally looking into distributing it for other countries. So what we did was we revamped the entire architecture of care to be like super dynamic and fully FHIR compliant. This ensures that care can now be deployed in any of the, in any country, any district, any combination of geographics. It supports everything out of the box. So you can fundamentally use it in Kerala for palliative care, in Karnataka for critical care, or in any other settings for any other use case. So what we made is we adopted like a 30-year-old framework called FHIR that has been constantly upgraded. So the FHIR version 6 is coming. We have a fully integrated FHIR R5. That means the full entire health record in the system is fully interoperable. So any data that comes into a system can now be transferred to any other system that has FHIR R5 compliance. And it's also backward compatible. That means you will be able to work with R4, R3, or any other versions. Also, other parts. So we consider this as like an ecosystem architecture. So Care Core is what we are, and there are many other plugs that can integrate into the system and work as like an OS. For example, tele-ICU is one use case. So the cameras, 5 monitors are like an addition on top of the care that will power the entire system. So you can pick and choose community powered plugins and other plugins together to build solutions. By solutions, I mean you can have a 10-bed ICU setup, you can run palliative care, you can run Care January, or you can run a Care HMIS, or you can run it for care clinics, or you can run it for care primary healthcare. So underneath, these are all the core module with multiple plugins enabled. For example, for palliative care, you need a state-level deployment. You need to bring in analytics tools, ETL pipelines, and deployment architectures. For HMIS, you are more focused on a single hospital. So you need payment gateways and printers, lab integrations, and stuff like that. For clinics, it's more dynamic, so you can like deploy it in like a cloud and run it for like under 2,000 rupees per month. January is another use case that we really found interesting very recently. This is to support animals. It's not just elephants, cats, dogs, shelters, rescue centers. They will also be able to use care to run their operations, because underneath, we believe in giving care to everyone. To answer the question, yes, there has been a lot of interest from a lot of people to deploy it in other places. There are also having discussions with multiple stakeholders who want to take it to different countries.
Wow, that's awesome. So this is something which is of course not just helping various different places, hospitals, and people in in India, but also across the world as well, right? So thanks, Bodhish, for showing some of these modules for a whole lot of the developers out over here. Can you give us a very quick overview on what does the tech stack really look like for this? So how can people really get started, or what is it that they must know as absolute basics to get started?
So all you need to do is go find OHC.network. It's quite easy. Just github.com OHC.network. You will have the repository there, and you'll be able to like fully see and get started from that point. Click on the repositories. You have Care FE, that is the front end for us, and you can also see Care, that's the backend. So backend is written in Python, so it's a Django web app. So we use it as an API. So you'll have the entire documentation in that repo itself. You can get started. There is backend specific documentation. All you need to run locally is like just run makeup. Your entire system will set up and you'll be good to go. If you want to add seed data, just run make load seed data. It should be able to like fully set it up for you. Make sure that you have Docker installed on your system. But that's it to get started with the backend. For people who are not familiar with backend or doesn't want to like set up and run, you are always welcome to like check out our front end repo. So it's a React TypeScript project. We use Sharksian a lot. So it's also similar setup. You just have to do npm install, npm setup, and npm run that. That's all you need to like get started. We also have like a develop server that is open for everyone, so you don't have to set up your backend. We've also given the test credentials, so you'll be able to like quickly jump into this system and like use the hosted backend to start building. The advantage with hosted backend is there is actually data and hospitals and facilities set up for people to come try it out and test in different scenarios. And there is also docs.oic.network, a lot of documentation on how to set it up, how is ABDM and related projects are like managed. We also have a development flow on documentation, apps, and CEPs. So care enhancements proposal is something that we just started building. This is inspired from the Python enhancement proposal. So every feature that we come out, we also document the motive requirements and user stories on how these are getting used and the proposed solutions. All of this is also another repo. You can find it as docs in oic.network. You can also go into the contribute section where we have like completely mentioned what is the prerequisites. We expect that you know Git and GitHub and some web development. If you don't know that, we have a course that can like get you started with the basics. It's also fully open and free for people to go check it out. And full entire setup instruction and questions and FAQs are in the documentation. We also have like an internship guideline handbook for people who are interning with us, along with how we manage stipends, how we manage our daily reviews. We also have a weekly community call that is open for everyone to come and join. So the link is publicly posted on Slack. You can come ask us questions, give us ideas, like also get feedback on things that you're working on. It's a community call. People can come and join and like work and collaborate with us. So everything that you need is fully documented in the system. And also you can go into the oic.network website. There are short links here to like quickly jump and start collaborating. This will take you to our Slack channel. It's also very easy. Just slack.oic.network. You'll be in the Slack channel.
That's great. Thanks a lot, Bodhish. So there's an interesting question out here in the chat as well, where there's a question on what is the closest commercially available software equivalent, and the viewer also politely mentions that if you do not want to name it, just provide a link where we can see who are, say, the competitors or so. So if you're comfortable answering that, feel free to.
Definitely. So in India, we don't have like a very commercially viable competitor yet. The reason being, we are actually doing it for the states to manage. So our major deployments are for states to manage tele-ICU or critical care. So if you look at the stats, so we are in like 200 hospitals across different geographies. These are state level instances that caters to remote hospitals across those. And there are other projects. So DHIS2, it's another open source project. There is Bumni in India, which is also another open source project that caters to hospitals. They also have a lot of other deployments. So these are potential competitors, but we don't see them as competitors because all of us work together in building features together. We also ideate on, it's more like a community who's trying to improve healthcare across the country. So whenever they want some help, we help them. They help us with feedback on our module. So it's more on the lines of collaborative effort than a competitive effort.
That's great. I like how you mentioned that last line. It's more of a collaborative effort than a competitive effort. That's good. So Bodhish, I believe many of your community and developers and your team as well use GitHub Copilot for a whole lot of development. Is that true? And how is that really helping?
So definitely, so all like everyone including the code members use Copilot a lot. So if you look at it, I mean, there was a time like during the Christmas, most of us were leave. Then we decided, okay, we'll do a full rewrite. So what happened was we wanted to integrate FHIR into the system because for our AI systems to work more efficiently, we wanted more structured data, and figuring out the healthcare from like for each module was really hard, and FHIR brought us insane clarity on how each of these records should look like, and what should be the relations, and how you will be able to architect these. So we wanted to move out from what we had into an FHIR compliant system that can potentially fully work. And with AI coming into the picture, we took a chance. So all of us who wanted to do like an experiment took in 15 days to completely rebuild the front end and the back end using AI to completely accelerate. So Copilot was super helpful. All you have to do was take the system, have the prompts ready, tell it what's architecture that is built in the backend, and it will be able to like beautifully write the entire code for you. And also it's trained, I mean, all of these models have trained on Sharpsy, and so the components and its props, all of it gets wired really beautifully. And another interesting thing is that it's really helpful in getting us build a lot of this documentation and test cases. So even before 3.0, what we were always struggling with was like writing tests. People like contributors and the core team hates writing a lot of test cases. And being like a healthcare tooling, we really wanted to improve our testing so that people are like, I mean, the tool that gets deployed works really well. And AI was super helpful. So for every step, we were able to like build workflows that can use ChatGPT and Copilot to build, write, and execute test cases in the system. Copilot has been like fundamentally driving the show for last 12 months at least now.
Wow, that's really great to hear. So you folks use GitHub Copilot to almost, like what I understand, re-architect a whole lot of major pieces of your application and infrastructure itself. You used it to write a whole lot of test cases, which you mentioned is a key aspect of a healthcare software and solution, because reliability is important as well. So that's that's really great to know that.
But one of the other trend that I'm also seeing in the community is that a lot of this PR coming in, people are actually using AI to generate the summaries, so pull request description. So it's I mean, almost everything is like now well written. It's Copilot's chat generation, like history generation, that actually fills it for them. I've been like super helpful there, and also the code reviews. I actively use the Copilot review to open and review the pull request from a lot of this open source contributor. All you have to do is like open it up, just click hit Copilot review. It will give you like a beautiful review on line by line changes and all the nitpicks it kinds of figures out. And so our contributed growth and AI becoming more accessible, we also internally feel that yes, AI has empowered the community to also help them contribute efficiently, because the entry barrier has reduced, and AI is able to like help them spot, and they'll be able to test it out and interact with the Copilot to build out features. With a lot of interactions with the community members, we are actively seeing a lot of the students in the community actively uses Copilot to build, since it got Copilot just turned free for a lot of these people.
Yeah. Wow, that's great. So a whole lot of folks are using it to generate descriptions as well, and also on the other end, you as maintainers are using it for code review, and a whole lot of students and people who are just getting started using the free version of Copilot as well. To do a whole lot more and contribute back to the project and the ecosystem itself. That's really great. So. So, outside of development itself, development of, the care software, How else are you using AI within your application and software? Be it for the end users or for I don't know, maybe doctors or the states, etc. How else is AI being used?
So we've worked with OpenAI. So OpenAI have written a blog on like how India is using AI for critical care infrastructure. So one of our common use cases is voice-driven filling. Before coming to that, so two actively used features are, one is vision. So we have, you have seen in the video that we have cameras across different facilities, and a nurse will have to go and enter the data for a patient who is in ICU every 1 hour. This is called as a nursing route, where they capture the pulse, SpO2, temperature, systolic and diastolic pressure, and respiratory rate. This is actually available in a 5-para monitor. Now we are able to remotely move the camera, point it at a 5-para monitor, snap it, and use the vision APIs to convert it into structured data. And the nurse can verify it and add it into the patient record. So there is an image and also the generated content. She can cross-reference, verify, and approve. It's not just directly writing the system. It's giving like a assistive system for the nurse to verify and enter, reducing the barrier for them to do these rounds for just capturing this record. And the flows for agents, it's just like how GPT works, ChatGPT works. So you have like a context loaded with nursing protocols and medical protocols for specific diseases, and you will be able to explore each of those verticals and ask questions and understand answers without hallucination. So we have created rack mechanisms to hold the hallucination really low, and the nurse can ask a question in Malayalam and it will respond in Malayalam back to them, making it easier for them to understand and learn more on the protocols. Another really interesting feature that we are actively developing is called as a Copilot for doctors in care. Technically, it'll be able to access the patient's EMR records with consent and generate summaries for the doctor to have understand it, like what was the previous encounters across the patient. For example, if you jump into care, a patient will have many encounters. They can see the patient's, they'll be able to see allergies, symptoms, diagnoses, and everything else filed for a patient. So the system will summarize it for them and help the doctor to differential diagnosis, talk more about the patient's condition, and also explore patient's record. This also ensures that it's to compliant APIs so that the data doesn't get saved or used for training. This will be like a quick help for doctors to use AI for, instead of copy pasting it to ChatGPT and seeking help, they'll have a one-click assistant that can help them. So I forgot to show this, but this is actually how care looks and how a encounter for a patient looks in care. And there's also the patient profile you can jump into. You can see their appointments, other encounters across different facilities, their health profile, ongoing medications, allergies, symptoms, and diagnosis generated. By the way, these are all test scenarios, and also all the updates, request if they have something generated, users linked to the patient, files uploaded, and all of it comes there. And you can also quickly jump into a patient, fill any kind of form. These are also FHR forms where you'll be able to customize a lot of this. You can have facilities. For in the facility, you can add all the administrative departments and have access control configured for that. You can also have locations for a facility. This is like an example of a hospital with an RICU and ICU and cardio. You can also open up different levels and understand how is this hospital organized and all of those data. These are all RIA components out there. You can also independently go and see all devices like cameras, thermometers, digital data emitting systems, and its middlewares can also be plugged into the tooling. Just like how I showed you the patient's encounter and the questionnaire, you'll be able to like fully customize at the department level. So in an admin dashboard, doctors and nurses can configure what should be the intensity for heart and what are its no-met and low-in codes. All of the value sets along with its inclusion and exclusion rules can be configured. There is questionnaires that you can like dynamically build for a patient, for example, like a doctor's progress note, where you can ask what's the condition. And also specific to observation generation condition, like ask for collection time, what method it was collected, who was the performer, who was the body side, and a lot of options on what questions you need to add. Is it a value set or types on string data, URL choice, and in structured you have allergy, medication request, statement, diagnosis, encounter. A lot of this comes in. And the beauty is that you can also add conditional enablements. For example, for another set of group of questions to come up, you need to say what condition needs to be met along with the questionnaire. So for every questionnaire that gets filed into the system, they will be able to generate stats out of it, graphs out of it, and plots. These are all configurable at cross system level. So each people and department can choose what plots they want to see, what are the medicines administered, required to be administered to the patient. If there are files that comes here, you can have threads of discussions in patient, have devices connected to a patient for plugging the data. Or if you want to draw a family tree, we have Excalibur support in the system where you can like quickly go draw and save the image. So that will get saved. The idea is that if you want to like show a heart valve and how it works, you can import an image and like edit on top of it. Really works well in mobiles and tablet devices. Also capture the patient's consent and link it to the system. Managing organizations who all wants to be have access. So if it's just cardiology, they will be the only persons who get access to the system. And also all statuses gets tracked in full time. You can also change the patient to another bed. Currently, the patient is in ICU 1. You can like move him to RICU bed 1 and assign them. Or you can also schedule it for like a later time so that the bed gets blocked. So this is really helpful in cases where you want to like move a patient into like an operation theater and assist like associated ICU. So you just move the patient there and you want to that bed blocked so that after the operation, the patient can move back there. So all of that can be done. You can also have location history for the patient. So this is tool in like quick summary, but the same system can be used. What I showed you was like one facility. You can have many facilities, and it has a dynamic RBAC that you can configure for access control. You can also have a governance structure involved so that the local self-governments in the country or state will be able to access the records of patients with consent on across different levels. So for example, in Kerala, in Ernakulam, they will be able to see all patients, all users, and all facilities. In case of patients, the record is limited to, so if you don't have clinical access permission, you'll only see data that is your demographic data and request. Everything else requires dynamic configuration. So this is our staging instance. So we have around 11 users connected to Ernakulam and 3,301 patients tested in the system. So this is how people use SAR tooling to like test and build on top of it.
This is great, Bodhish. So there are a couple of questions, in the chat, and one of them summarizing the theme is for those of folks who want to start using it in their own countries. How to get started, or how do they reach out? We have a question on, can I adopt this and use it in my country? And
Definitely.
one other comment/question on Australia will come on board too. And one other question and comment around what about Germany? So if someone is interested in getting started and using it in their region, how do they get started?
All they just do is find out ohc.network. It's a ohc.network. It's a domain. It has all details on the product, documentation, the repositories, and where everything is kept. There's also like a product page for care. Just jump into care where it shows the features and how different use cases, how we can like manage scheduling, public facility pages, customizable forms, AI-powered plugins, and all the features. So you'll have basics of features and documentation here. And the best part is you can directly connect us to Slack. Just click on slack.oic.network. It'll open up our Slack channel, and you'll be able to join in. And yeah, I'm Bodhi in the Slack. You'll be able to ping me. We'll be super happy to help you.
Awesome. So, in a nutshell, you can check out ohc.network for all of the features, and also jump onto Slack and reach out to Bodhi on Slack, who can help out. So there's one other question, Bodhish, as to, do you use cloud or on-prem? Is it hybrid? Is it anything? Is it where to host this? How does this work?
So we have different solutions. So this is like a KS deployment architecture. So this is in AWS. So fundamentally, we are cloud agnostic. So for you to deploy it in AWS, we have a Terraform script. It will only take you 15 minutes for the entire cluster and domains to be get configured, and you can start running. Like all it requires is a key and like a key with access and Terraform. In 15 minutes, you have the entire cluster with all configurations, WAF, firewalls, domains, and everything configured, running live for you in 15 minutes. So this is like a high-level architecture, but you'll be able to do on-prem hosting. You'll be able to do cloud-agnostic hosting. So, for example, 10byte has Azure and Google Cloud hosting. So in Kerala, there is AWS hosted system. So there is NGOs that are using like on-prem and local deployments. So it really doesn't matter what you want to use. And so Care Core with plugins. So plugins can have their own deployments. For example, the terminology server, like a snowstorm server that you need to have for terminology loading. You can decide where, like for one instance, for many instances, you can like run one snowstorm server, or like it's up to you to configure your deployment setup. But we also have documentation on like how an ideal setup should look like on our docs page, and also there is a full section on DevOps and deployment. So there is documentation on GCP, AWS, DigitalOcean, and also like an overview and details on how do you need to build it and go ahead. So since we are supporting a lot of these deployments, so this is fully public and live for anyone to check it out.
Awesome. So, Bodhish, one question for you. While throughout the conversation, you mentioned a whole lot of protocol terms as well as medical terms, etc. So, how important is the domain knowledge needed for someone to contribute or even build? Because this is my guess. I'm guessing that you're probably not from the medical domain, and maybe a whole lot of the developers as well, right? Whereas there is a very different domain knowledge itself to know about some of these aspects to build those as well. So how much is that important, or how can the community or your team really help out developers to kind of even understand what is it that we need to build?
So when I started coming in, so I was into education. I was building tools in education, and it's another project. But when I came in, I had zero clue on healthcare. All I had was like an experience building like a smaller version of HMIS when I was in college, and it was a startup. I tried to run it in Bangalore. That didn't really work out. I had to shut shop. So when I came in, I had like zero experience, but was more on to like, okay, I like to build products and I understand technology, so wanted to help. So the beautiful thing about the community that we built was it's actually like an interop of technologists with medical professionals. So we bring in doctors into the Slack channel. We bring in doctors into GitHub. We ask them to file issues. We ask nurses to file issues, so that the feedback and the requests are actually coming firsthand from the professionals who are using the system. So for every time when we didn't know something, we go to a doctor. There is Indian Medical Association, a Kochi chapter, who are like fully supporting us, and there are doctors across the country who are collaborating and using the tool. So for anything clinical, I mean, healthcare is a very complex domain. For you to like have full understanding, it will take years. For us, it took like 5 years for us to even like fully understand how the system works, how this is work, how like an HMIS should work, and what is the ideal version. So we started building and evolving on the fly. But now we are like super solid and super stable in terms of context and awareness. But generally, you have a lot of people who are really willing to help from across the world uh, with a lot of clinical background. They need technologists and people who understand technology to come solve the problems for them. So I even have a case when we were building this dashboards that you can see in the screen. So there was shifting happening in Ernakulam, and the doctors wanted a small feature. So in the priority of things that I wanted to do, that small click to copy was at the last. So they wanted it really fast because they wanted to use it for transporting people. And doctors, they called up engineers that they have worked with. So these are actually senior people. They found out an engineer who, in their class, who knew the GitHub. So the doctor was like, Bori, give me the GitHub repo. I sent him the link. And in like 2 hours, I have a feature pull request coming in that is from a friend of the doctor who created a feature for copy paste. We got it merged and they are super happy. So the idea is you don't need to like fully understand the context. There are a lot of people who will like help you move forward. Like any question you have, all you have to do is put it out, ask the doctors, ask in healthcare channel. People will be able to come help you move forward. And there are a lot of really good standards. For example, HL7 FHIR is like has evolved over time. So it has really good standards and a lot of documentation on how each of these modules or models should look like. How do you capture a specific diagnosis? What all are the related things also you need to capture along with it? How does the encounter should look like? All of this is out there as like standards built out over the years. And there are also terminology servers and terminologies. For example, fever has a specific code. This code comes from SNOMED and it is universally acceptable. So any data, there is like SNOMED codes, there is Loing codes, there is ICD 10 and 11 codes. So there are systems which you can use to bring in masters for different medications, different symptoms, allergies, and all kind of use cases. All you have to do is assemble them together as a really cool product that is really helpful for people to work.
That's great. And that's isn't that really the beauty of open source? Because you don't need to have all of the answers, because there is the community who is there to help you out. And also, I think most importantly, you have your end users also a part of the community, like how you mentioned, the doctors also out there on Slack and GitHub, helping folks understand what is that requirement or how to go about, really solving for it, etc. Great. I think one last thing, Bodhish, I believe, there is something around MediSpeak that you wanted to share about. So what's that?
So MediSpeak is our voice assistant. So what we really figured out was like over the time, it was very painful. Like the forms builder I have shown you, like when you make it like super easy for people to like configure forms, the doctors and the systems and the administrators will want to capture as many data as possible. So they will want to build complex forms, long forms for people to enter data. Even though these are drop downs, when it's not you don't need an engineer to code it, people actually go and like make it like really big. So nurses, it was becoming cumbersome, and also they are never trained to type really fast or type in English. So their training is always related to giving care, and they were never trained to be a data entry staff for a lot of the systems to work. But clinical data entry is critical. That's when we figured out why can't we use voice to fill in. So this started as like a side experiment 2 years back with ChatGPT, with GPT, a Whisper APIs that got changed over time and evolved into multimodal APIs right now. But the idea is very simple. All you need is for any form, the system has the context on what are the forms, what are the values it's using, what are the drop downs, and what are the inputs. And also it has context around the patient and also the doctor or a nurse who is using it. It's a cardio physician or like a nurse in palliative care. So along with this context, a nurse can just record a voice. We will be able to use LLMs to transpose this transcription and the context into filling that entire form for them. So all they have to do is take the phone, just click a button, talk about the patient and all the conditions and symptoms that they have observed. We will be able to structure it into different questionnaires and give it to them so that they can review, make changes, and use it. This is actively used in a lot of NGOs in Kerala right now. People are giving us like really good feedback, and there is actually like an integration with Bamni right now. Bamni is another open source tool that does healthcare management. So just like before I told about contributor, they also use MediSpeak for voice transcription. So there are many other products also like KushiBaby in Karnataka and other tools who have integrated the voice to automatic form filling as part of the core feature. So underneath it uses models of Whisper and LLM. So you can replace it with any other model underneath to have this entire thing flowing.
Awesome.
So we also have a video about it at the end. It's like 1 minute long.
Okay, perfect then. Let's bring up that video to see MediSpeak in action.
ഹലോ നമസ്കാരം എനിക്ക് ഓക്കെ വോണ്ട് ഡ്രസ്സിംഗ് അല്ലേ ആൾ അറേഞ്ച് ചെയ്തേക്കാം ഓക്കെ പെയിനും ഡിസ്കംഫർട്ടും ഒന്നും ഇല്ലല്ലോ ഓക്കെ ഞാനിപ്പോൾ തന്നെ സ്റ്റാഫിനെ അറേഞ്ച് ചെയ്തേക്കാം കേട്ടോ ഒരു ഹാഫ് ആൻ അവറിനുള്ളിൽ സ്റ്റാഫ് വരും ഓക്കെ ശരി താങ്ക് യു
അഗസ്റ്റിൻ്റെ വൂണ്ട് ഏകദേശം ഉണങ്ങി വരുന്നുണ്ട്. BP 120/70, സാച്ചുറേഷൻ 98, പൾസ് 82, റെസ്പിറേറ്ററി റേറ്റ് 14. നേരത്തെ പോലെ മൂത്രം ഒഴിക്കുന്നിടത്ത് ഇപ്പോൾ വേദനയില്ല, വേദന ബെറ്ററാണ്. പിന്നെ സാറ് പറഞ്ഞ ഗുളിക കഴിക്കുന്നുണ്ട്. പേഷ്യൻ്റ് നേരത്തെക്കാളും ഉറക്കം കിട്ടുന്നുണ്ട്. രാത്രിയിലൊന്നും വലിയ ബുദ്ധിമുട്ടുകളൊന്നും ഇപ്പോൾ ഇല്ല. പേഷ്യൻ്റ് നേരത്തെക്കാളും ഓക്കെയാണ്.
So the nurse spoke in a local language called Malayalam in India.
മെഡിസ്പെക് ആപ്പ് ഉപയോഗിക്കുന്നതിൽ ആരും കൺഫ്യൂസ്ഡ് ആവേണ്ട കാര്യമില്ല. സാധാരണ നമ്മൾ മലയാളത്തിൽ പറയുന്ന കാര്യങ്ങൾ റെക്കോർഡ് ചെയ്ത് ഇംഗ്ലീഷിലോട്ട് ട്രാൻസ്ലേറ്റ് ചെയ്ത് വരുന്നു. അത് കാരണം നമുക്ക് സമയലാഭം ഉണ്ടാകുന്നു. പേഷ്യൻറ്റിന് ആ സമയം കൊണ്ട് നമുക്ക് പേഷ്യൻറ്റിന് കെയർ കൊടുക്കാൻ പറ്റുന്നു.
സമയം വളരെ വിലപ്പെട്ടതാണ്. എസ്പെഷ്യലി ഹെൽത്ത് കെയർ ഫീൽഡിൽ നമ്മൾ മാക്സിമം ടൈം പേഷ്യൻസിന് വേണ്ടിയാണ് കൊടുക്കേണ്ടത്. അപ്പോൾ നമ്മുടെ പേഷ്യൻ്റെ ഡേറ്റ ഫില്ല് ചെയ്യാൻ ഒരു ഈസി ടെക്നോളജിയാണ് മെഡിസ്പീക്ക്. മെഡിസ്പീക്ക് ഉപയോഗിച്ച് നമ്മുടെ സ്റ്റാഫിന് ഡയറക്റ്റ് ഫ്രം വോയിസ് ടു ടെക്സ്റ്റ് പേഷ്യൻ്റ് ഡേറ്റ ഫിൽ ചെയ്യാൻ പറ്റുന്നുണ്ട്. അഥവാ ഇംഗ്ലീഷ് കംഫർട്ടബിൾ അല്ലെങ്കിൽ മലയാളത്തിലും സംസാരിച്ച് ലൈവായിട്ട് ട്രാൻസ്ലേറ്റ് ആയി പേഷ്യൻ്റ് ഡേറ്റ ഇംഗ്ലീഷിലോട്ട് ട്രാൻസ്ക്രൈബ് ചെയ്ത് ഫിൽ ചെയ്യാൻ പറ്റുന്നുണ്ട്. അതും സ്മാർട്ട് ഫോണിൻ്റെ കൺവീനിയൻസ് വെച്ച്. വേറെ ഒരു ഡിവൈസും ആവശ്യമില്ല, ലാപ്ടോപ്പ് ഒന്നും വേണം. ജസ്റ്റ് എവറി ഡേ ക്യാരി ചെയ്യുന്ന സ്മാർട്ട് ഫോൺ വെച്ച്.
Yeah, so for everyone, just the context, it was the nurse was going like a regular visit for palliative care delivery, and she spoke in Malayalam. The system was able to understand it and fill it for the nurse. This is their regular workflow, and we just send a cameraman to like record how the system works, and that's that whole video.
Wow, that's awesome. That's great. Thank you so much, Bodhish. Before we wind up with this live stream, anything final thoughts or anything that you want to share with the audience?
For everyone who's watching from around the world, we really want your help. As developers, come help us out, contribute. Like if you're not actively in development, give us a star in GitHub so that other people can discover us better. Talk to other people about healthcare, and also help us build a very inclusive, open, and transparent community where people can use it. If you have feedback, if you have ideas that you want to explore, or if you want to build tools or plugins with us, do reach out to us. We'll be like super happy to collaborate on any of those use cases. And this is fundamentally a tool that you can take it, customize it, and run it on your own terms. So it's a fully open source MIT licensed tooling. It's also digital public good, recognized by United Nations. So we really want you guys to like explore look into Open Healthcare Network, see the video from GitHub. There are also many other impact stories in YouTube. It'll be super great if you can come contribute with us and help save a lot of lives.
That's awesome. The last thing that you mentioned, it's also recognized as a digital public good by the United Nations DPG Alliance, right? The Digital Public Good Alliance. So
Yeah.
that's really great. So thank you so much, Bodhish, for being here on the live stream and for everything that you're doing along with your team for Open Healthcare Network, building in open and also kind of sharing this with everyone who is interested as well. A lot of you, I know there are questions that you still have, etc. Feel free to reach out to Bodhish on LinkedIn, on Slack, on many other places. And I think, Bodhish, there are still a few questions still coming in on LinkedIn. So hopefully, whenever you have time, you're able to address some of those as well on LinkedIn in this very live stream event video as well. So that's that's about it. Thank you once again, Bodhish, for joining us today.
Thanks, Karan. Thanks to the GitHub team. It's been like really great, and we are really excited.
Thank you. So thank you, everyone. That was Bodhish Thomas from the Open Healthcare Network, who is the chief architect and also the co-founder of the Open Healthcare Network. So in the past, 1 hour or so, we've gone through so much exciting stuff, right from how did this idea come up of building Open Healthcare Network? How did the team and the community really get support from the community of developers in open source? How did they help make that developer experience better and that contributing experience better as well for developers to get started and to start contributing? Bodhish also walked us through a whole lot of how care is built, how it is structured, where you can go for a whole lot more information, the documentation, the different use cases and examples also of how AI is being used in development as well as in the application itself. And of course, we also saw a really, really nice way of how they've built their own leaderboard as well to help all of the open source community get started with Open Healthcare Network and start contributing, and how various different open source projects also can adopt, a similar leaderboard to get started as well. So thank you everyone so much for joining in live, or for those of you who are watching a recording of this video later on. I hope this has been useful for you. We at GitHub, through Open Source Friday live streams, keep bringing such really interesting open source projects, maintainers, and also stories about open source, for all of you, for developers, for maintainers, etc. So stay tuned for more of such live streams, which will be coming in. You can follow us on YouTube, on GitHub, or stay tuned to the LinkedIn live events, or even catch us on Twitch, etc. for a whole lot of these. So stay tuned to GitHub on all of the social channels to hear more about Open Source Friday, and also a whole lot more live streams and stories that we bring to you. So thank you so much for joining again. I'm Karan from GitHub signing off, and I'll see you again in the next Open Source Friday live stream coming live from India. Thank you, everyone.